If we've learned anything over the past few years about our health, it's that when and where you need care is constantly changing. Whether it's finding a doctor, getting a ride to appointments, or talking to a nurse 24/7, care should be able to meet you where you are when you need it most. Meet Joe. Joe is 78 years old and a new Medicare Advantage member with a United Healthcare Dual Special Needs Plan. Medicare Advantage plans combine Original Medicare's Part A and Part B into one plan and usually include prescription drug coverage. These plans often also offer additional benefits such as dental, vision, hearing, and fitness. Dual Special Needs plans are unique Medicare Advantage plans for people who have both Medicare and Medicaid that provide added benefits and support. Joe is eager to find support in staying on top of his health needs, but he doesn't really have a full understanding of his new health plan. Luckily for Joe, United Healthcare gives him access to a healthcare navigator, a one-on-one point of contact who will listen carefully, anticipate his needs, and help find solutions. Joe's navigator, Reggie, outlines his plan's benefits and helps him schedule his first annual house calls visit. This no-cost clinical service allows members to meet with an advanced practice clinician from the comfort and convenience of their home. It's a way to help members stay on top of their health between regular doctor visits. A nurse practitioner, Diane, comes to visit Joe in his home for his first house call. When Diane arrives for the visit, she examines the swelling, knee pain, and other red flags in Joe's left leg, which Joe mentions have been going on for a few months but just got worse. Diane alerts Joe's doctor and they agree Joe should go to the ER immediately. Joe is hesitant, explaining he's always had leg issues, but Diane remains persistent. When Joe arrives at the ER, an ultrasound reveals a potentially fatal blood clot in his left leg. Thankfully, Joe's doctors are able to address this issue and prescribe appropriate medication. Joe realizes that without Diane's persistence, he may not have received the essential, time-sensitive care he needed. A few days later, Reggie calls Joe to see how he's feeling and also asks if Joe has everything he needs, including medications, toiletries, and food. Joe notes that his fridge is pretty bare, but he doesn't have the money right now for groceries. Reggie lets Joe know about his monthly over-the-counter healthy food and utilities benefit, which offers Dual Special Needs Plan members an annual average of $2,200 to spend across covered groceries and over-the-counter products between shopping trips or online delivery orders, plus eligible utilities expenses like natural gas, electricity, and home internet. Joe is eager to stock up on healthy foods and some new bandages for his knee, and places his delivery order that same day. While Medicare Advantage plans deliver affordable, quality health care, programs like house calls and support from compassionate navigators also offer a chance to assess a member's social determinants of health needs. In fact, it's been shown that 80% of what affects a person's health happens outside of a clinical setting. And within 90 days of a house calls visit, 76% of members had a follow-up visit with their primary care physician. With further assistance from Reggie, Joe also schedules a series of year-end appointments, dental, hearing, and eye exams. Reggie also helps Joe sign up for a gym membership at no cost through Renew Active by United Healthcare, and Joe begins light stationary cardio once per week. With his new lease on life and a firm grasp of how his health plan can support his health journey, Joe has a changed outlook on preventive care. Thanks to United Healthcare's Dual Special Needs Plan features and benefits, Joe hopes to keep his health on track for years to come.